The radiologically isolated syndrome is oftentimes a difficult situation, both for people who are coming in with this and also for the neurologists who are treating people with radiologically isolated syndrome. The radiologically isolated syndrome essentially is a situation where people get an MRI for reasons that are completely unrelated to multiple sclerosis. So they may have symptoms such as migraine, or they may get their MRIs after an accident. And then the radiologists are identifying lesions on the MRI that are typical for multiple sclerosis in terms of how they're distributed and how they look. And then the patients come and see us in the clinic, and we all wonder what to do next, because we can't make a diagnosis of multiple sclerosis and simply start treating people. And that's really where the challenge lies. At the ACTRIMS meeting, we've seen a lot of MRI data on people with radiologically isolated syndrome, including from our center here, where Dr. O has established our cohort several years ago. What's been less studied is the peripheral immune compartment of people with radiologically isolated syndrome, or RIS, I should say. And this is really where our work comes in. We're interested in finding out whether there are immune cells or immune profiles that are telling us whether or not a person with RIS is at risk of developing MS in the very near future. And we think that if we're comparing the immune system or the immune profiles of people with RIS to MS, and we see that they're very similar, that on a biological level, there's probably something going on in those people with RIS that is just so similar to MS that it may then trigger us to possibly start treating these people, or at least tell them, well, on the one hand side, we have the images, but we also now have data from the peripheral blood that looks very much like multiple sclerosis. So we think that we're getting one step closer to making a diagnosis, at least for some people, those who do have an immune profile that is similar to people with MS. So for our work, we've been using mass cytometry, because this technology allows us to study many immune cell markers on individual cells. And so essentially what we're doing is we take blood from people, and in a relatively unbiased way, we analyze the immune cell surface markers on the different immune cell populations. We focus on T cells and B cells, but we actually also have data on smaller cell populations like dendritic cells. And essentially, we're studying those surface markers on all these different cells. And what we've found is that there are certain people with RIS that actually have an immune profile that is very similar to people with MS, with markers that are highly expressed on their T lymphocytes. And we also know that these markers that we found are telling us that the cells are relatively likely to cross the blood-brain barrier and display a pro-inflammatory phenotype. So even on the biological level, we're trying to make these connections between what the cell can actually do in terms of being pro-inflammatory, contributing to a lesion, and also the part where the immune cell is relatively likely to not just stay in the periphery, in the blood, but also to cross the blood-brain barrier and get into the central nervous system. So at this point, what we have is cross-sectional data. We're essentially comparing people with RIS and people with MS and healthy controls, those three groups, at one point in time. And we're already seeing a few interesting things, but what's really going to be interesting now is to follow people over time and to see who in the RIS group is going to develop clinical symptoms and receive a diagnosis of MS. So that's how our study really is designed to first give us some clues in the cross-sectional design, but really the longitudinal follow-up is where we will be able to confirm whether or not any of these markers that we're finding out is actually going to have a prognostic value. So that will hopefully confirm some of the things we're finding right now, but it's also possible that we'll find completely new things when we're looking at this data longitudinally from that perspective.